It occurs millions of times a year on newborns, children, and adults to obtain accurate clinical information. Capillary blood collection has become a routine procedure performed on patients of all ages for diagnostic testing when only small amounts of blood are needed or when only small amounts of blood are available. Today's laboratories are equipped with advanced instrumentation capable of delivering results from as little as 10 microliters of blood. In step with advances made in the area of blood analysis is the availability of a superior capillary blood collection system from RAM Scientific. In contrast to the older, more traditional methods of scooping, the 100% plastic, completely assembled safety fill system offers advantages that make the process not only easier and safer, but also minimizes clotting and yields samples that are virtually tissue-free.
Capillary action pulls the blood, eliminating the need for scooping, which leads to tissue fluid contamination. It also allows for a predefined volume of blood to anticoagulant ratio, leading to accurate laboratory results. In addition, the capillary tube is coated with the anticoagulant, immediately mixing the blood, thus minimizing clotting.
Let's begin the safety fill collection procedure. First, we will demonstrate a finger stick collection, followed by a heel stick collection. The middle or ring finger is the best choice for a finger stick. Carefully select the finger that is not calloused, injured, or swollen. Prepare the puncture site by warming the area. If the patient's hand is particularly cold, it will be necessary to warm it with a warming device for 5 to 10 minutes. Using an alcohol pad, cleanse the puncture site. Allow the site to dry, otherwise hemolysis may occur. Using a lancet device with a retractable blade, puncture across the lines of the fingerprints and slightly to the side of the ball of the finger to produce a drop of blood. Wipe away the first drop of blood with a sterile gauze pad. Hold the safety fill collection device horizontally so that the capillary tube touches the drop of blood. The blood drop will be pulled into the tube via capillary action. To produce subsequent drops, allow several seconds between each draw. This will allow the capillaries in the finger to refill. Repeat this procedure until the capillary tube is full end to end. The collection process is now complete. Invert the tube in a vertical position and gently tap to assist blood flow into the microtube. Remove the capillary tube together with the colored sleeve and discard in the appropriate biohazard container. Close the microtube with the attached cap. Gently apply pressure to the puncture site using a sterile gauze pad until the bleeding has stopped. Apply an adhesive strip. Tubes containing anticoagulants should be thoroughly mixed by holding the tube between the thumb and forefinger and inverting 8 or 10 times. Label the tube and process the sample according to your organization's guidelines. On infants, the blood should be drawn from the heel. Select a site on the plantar surface of the heel, as indicated on the shaded area. The puncture depth should not exceed 2.4 millimeters. Follow the blood collection procedure as previously demonstrated. Here are the key points to remember for a successful draw. Be sure the puncture site is clean and dry. Puncture across, not parallel to the print lines. Hold safety fill horizontally so that only the capillary tube touches the blood drop. Do not scoop. The sample draw is complete once you have filled the capillary tube end to end. Please refer to the illustrated and written instructions that are packaged with the safety fill system. RAM Scientific offers the most comprehensive line of capillary blood collection systems. Whether for hematology, chemistry, or lead testing, there is a safety fill product for you and your patients.